Hi everyone, Dr. Yusuf Mathai here from Oregon Health DPC, where we blend science and personalized care to help you live your best, healthiest, fullest life. Today I wanted to share something hopefully you may not have heard about in the news. This is something a client shared recently with us, and it's how everyday medications we already use might help to fight against cancer. The movement is called the ReDO project, and it's a reminder that innovation sometimes does come from unexpected places. The ReDO project stands for Repurposing Drugs in Oncology. It's an international effort looking at whether medications like metformin, used for diabetes, or propranolol, used for blood pressure, might actually help in treating certain cancers. The beauty of this idea is that we already know these medications are safe and how they work in the body. If they show promise in slowing or fighting cancer cells, we could bring new treatment options to patients faster and at a much lower cost. Now, developing cancer drugs can take years and unfortunately does cost millions and millions of dollars. The ReDO project is showing that repurposing existing medications could offer hope sooner using drugs that are already widely available and, importantly, affordable. Now imagine if something as common as metformin could help slow down prostate cancer or pancreatic cancer, or if a beta blocker like propranolol could help prevent cancer from spreading. I mean, these are real possibilities, and right now there are over 800 clinical trials happening worldwide testing these ideas. And here are just a couple of examples currently being studied. So metformin for prostate, lung, pancreatic cancer. Mebendazole is an anti-parasitic medication that's being studied for colorectal cancer. Propranolol, again a blood pressure medication for breast cancer and multiple myeloma. Enoxaparin is a blood thinner that's being looked at for certain throat cancers. Even statin drugs, cholesterol medications like atorvastatin, are being studied for possible cancer benefits. Now, these studies, like I said, are happening in over 40 countries with thousands of patients participating, hopefully expanding the hope for those facing cancer. Now, one of the reasons we can share information like this with you is because in our practice, our physicians have time to dig into your questions and stay current on emerging treatments like this. The reality is there is so much new medical information released every day that no one doctor can keep up with it all. We can't. But because of the way we structure our practice, we can often slow down, take your questions seriously, and dive deeper into research that may be relevant to you or your loved ones. It's one of the ways we bring you personalized evidence-based care, not just during your visit, but as a partner in your long-term health journey. If you or a loved one is facing a cancer diagnosis, remember that researchers are working on innovative treatments every day, sometimes using medications already in your medicine cabinet. If you want to learn a little bit more about these emerging treatment approaches or how integrative care can support you, reach out to us. Our office number is 503-506-8500, or you can email us at admin@oregonhealthdpc.com. Finally, remember, you got this. Keep showing up for yourself. We'll be here cheering you on every step of the way. Again, I'm Dr. Mathai with Oregon Health DPC, and we'll see you in the next video.